70% of healthcare workers are women, including 90% of nurses and 93% of midwives. Yet only 25% of healthcare leadership roles are women, like yourself. Why is that? And how do we put more women in positions of leadership? And how do we keep them there?
I think there's several things that come to mind. One, I think that in healthcare, as well as in many other organizations and industries, boards are male dominant. And a lot of times the board members are those ones that are picking the leaders of the organizations, those C-suites. So there's one. So my challenge to all of you is, I know that you all have a lot on your plate, but if at all possible, when asked to serve on boards, especially those in nonprofit, or any board that that you can make a difference, please join, because boards need females and they need strong female figures. So I think that is the place that we all should have a seat. So I think that's one. I think that collectively we kind of gravitate towards people that look like us and think like us and are us. And so a lot of times that's in Oklahoma, older white men. And so healthcare is no different. And so I think that has kept a lot of women out. Also, organizations don't always have developmental programs or mentorship programs that allow women to work them way up the ladder. And so that too has held us back. In healthcare, in particular, I think women are behind the 8 ball already, because historically, out of history and habit, we have been those nurses, kind of that bedside support system, if you will, over the male doctor, or maybe the business office manager, or even if you see women in healthcare, a lot of times they're in an HR role. So out of history and habit, we're trying to gain ground and starting to get there, but a long way to go. So those are kind of thoughts off the top of my head. And sometimes even the way that position descriptions are written may deter women. If women will see something that might say travel is required. Well, if you have young children at home, or you're a single mom, you may not have that support system, or all of the above, that may deter you from going after that C-suite level, thinking, well, I almost abandoning my family.